This is the quick review of Fmge December 2017. So let's start it. First question is squat sign in active autosclerosis is seen. Second question, boy with fever, lateral tonsil swelling leading to ovular deviation. Diagnosis is quinsy or paratonsillar abscess. Third question, treatment for nasopharyngeal carcinoma is radiotherapy. Fourth question, recurrent laryngeal nerve doesn't supply to cricothyroid cartilage. Fifth question, superior laryngeal palsy will not lead to aspiration, stridor and vocal cord bends. Sixth, spontaneous or post-trauma watery nasal discharge can be cerebrospinal fluid, rhinorrhea, allergic rhinitis and atrophic. Seventh is operation for atrophic rhinitis is Young's operation. Eighth, most common cause of facial nerve palsy is idiopathic Bell's palsy. Ninth, most common site of laryngeal web is anterior. 10th is which nerve passes through cavernous sinus is 6th nerve, abducens nerve. Chronic upper airway obstruction by adenoids and tonsils will lead to cor pulmonale. 12th, Rathke's pouch derivative is craniopharyngioma. 13th, ultimobrachial body derivative is parafollicular cells of thyroid. 14th, action of superior rectus, elevation, intorsion and adduction. 15th, karyotype of Down syndrome is trisomy 21. 16th, cause of gynecomastia in newborn is maternal estrogen and maternal progesterone. 17th, most common cause of primary amenorrhea is Turner syndrome. 18th, cause of secondary amenorrhea is pelvic radiation. 19th, microsporum affects skin and hair. 20. WHO level for anemia in pregnancy is 11 gram or 10 gram. Floor of femoral triangle is formed by pectineus. 22. Uterine artery supply arcuate, then radial, then basal and spiral. ARBS. ARBS. Arcuate, radial, basal, spiral. 23. Most common site of peripheral artery aneurysm is popliteal artery. 24th, most cochleal toxic drug is kanamycin. Other options are gentamicin, amikacin and streptomycin. 25th, alveolar ventilation is directly proportional to the surface of the alveoli. 26th, hyaline membrane is seen in ARDS, interstitial lung disease, asthma and emphysema. 27th, note the sign of placenta separation is shortening of cord. 28th, amniocentesis is done at 14 to 15 weeks. 29th, screening for Down syndrome in general population is USG or maternal serum makers. 30. GFR is best measured by aminohippuric acid, inulin and insulin. 31st, 24th week gravid at what level of abdomen is umbilicus. 32. Identify skull marked suture is pterion and asterion. 33. Leukocyte rolling over endothelial cells of blood vessel is by selection, integrins and PECAM2. 34th, for diagnosis of schizophrenia, symptoms should be present for 6 months. 35. Men with bulla on face and neck, flaccid bulla, spreading and Nikolsky sign positive. Diagnosis is pemphigus vulgaris. 36th, picture of a back showing many hyperpigmented patches. Which organism is Theresiophorum? 37th, term for lesbian is tribadism. 38th, celiac artery contribution in esophagus is left gastric artery and esophageal artery. 39th, glucose 6-phosphate dehydrogenase deficiency causes hemolytic anemia. 40. Lateral lemniscus receives fibers from both ears. 41. Pre-exposure rabies prophylaxis 0, 7 and 28 days. 42. Site of Herbadon nodules is DIP. 43. Man with 40% surface burn 50 kg. How much fluid in first 8 hours? Answer is 4 liter. 44. Most common endometrial cancer is adenocarcinoma. 45. 21 teeth present at what age? 5 year, 8 year and 10 year. 46. Cattle sign on retina is CRAO. 47. Crowding phenomenon is amblyopia. 48. Which tumor is most common post-renal transplant is skin tumor and lymphoma. If you want to know most common tumors, you can see my previous videos. I will give you link in the description box or in the comment box if you want to see that video. Let's continue. Peak of robotic surgery looks somewhat like laparoscopy. 50th question. Most common tumor in a HIV patient before antiretroviral drugs called Kaposi tumor. 51 is man with lepromatous leprosy who had undergone chemo develops various nodules. Type of hypersensitivity is type 3 hypersensitivity. 52. Cause of normal anion gap metabolic acidosis is diarrhea. 53. Cause of normal anion gap metabolic acidosis is renal tubular acidosis. 54. Man took some drug, developed swelling is TEN. 55. Best test to evaluate adequate fluid resuscitation in a burn patient is urine output. 56. Liquefactive necrosis seen in brain. 57. Rising JVP with inspiration cosmal sign seen in constrictive pericarditis. 58. Radiological test for staging of endometrial carcinoma invasion is MRI, CT contrast, pelvis TAS, TVS. 59th. Treatment for amblyopia is occlusion. 60. For how long immunosuppressive therapy should be given post-renal transplant? Can be lifelong, 3 months, 6 months or 9 months. 61. Location of lens in a spectacle at nodal point, anterior and posterior point. 62. Site of internal hordeolum is Mabonian glands. 63. Name for lead leg sign is von Graef. 64. Normally neonates are hypermetrops. 65. Normal pupil of newborn is mid-dilated, dilated, constricted or normal. 66. Incubation period for hepatitis virus B is 30 to 150 days. Calcium RDA for elderly is 1200 mg. 68. Quintana fever caused by Betonilla. 69th. Chickenpox rashes, centripetal centrifugal or variable. 70. Route of spread of TB to kidney is hematogenous. 71. Why is esmolol short-acting blood esterase activity? Rapid renal clearance. 72. Framingham heart study is prospective cohort. 73. What is incidence? New cases in a population. 74. QLEX is a vector for JE. 75. Cell migration is by herpetine sulfate, heparin, dermatine sulfate. 76. IQ for imbecile is 25 to 50. 77. Gynecological pressure is 5 to 10 milligram, 10 to 20 milligram. 78. Structure not visualized by hysteroscopy is cervical canal, tubal ostia or uterine surface. 79. Bull rider's thumb which ligament damage? Medial, radial, anterior and posterior. 80. Lab panel high PTH, high ALP, low calcium, low PO4. Diagnosis is VITD deficiency, osteoporosis and Paget disease. 81. Effect on insulin on DKA type 1. Patient is high bicarbonate, glucosuria and hyperkalemia. 82 is opportunistic screening for DM and HTN according to N 30 year, 40 year or 50 years. 83 cephalic index of 70 to 75 is Arians. 84 choice of concentration in a patient with history of gestational diabetes mellitus, low dose OCP, DMPA, CUT or all of the above are the options. 85 choice of contraception in a lactating woman is progesterone pill. 86 false statement regarding gastrinoma is ACC or according with men 1. Most common presentation is GOO and most common site is duodenum. Its relative silent condition. False statement regarding Peutz-Jeghers syndrome is associated with mucosal, skin, lip melanosis. It's a AD disorder. Has multiple polyp in intestine. Often surgery might be required for polyp bleeding. 88. False statement about Crohn's disease is ingestion resection is curative. Has multiple polyp in intestine. Often surgery might be required for polyp bleeding. 88. False statement about Crohn's disease is intestine resection is curative. 89. Organism causing Whipple diagnose or Whipple disease. Number T Whipple in option Actinobacter and Giardia. 90. Type 1 diabetes mellitus. Time of retinopathy development is 1 to 5 years. 91. Vaccine in pregnancy, rubella, BCG, yellow fever or OPV. 92. Female with curdy white discharge caused by Candida. 93. Presenting case of an infant with intussusception, fluid resuscitation, nasogastric tube decompression, plus antibiotic plus air enema and other option had surgery. 94. Presentation of TE fistula. Next will be insert nasogastric tube. 95. Characteristic feature for kwashiorkor is edema, pluckable hair. 96. Drug of choice for acute gout is naproxen, probenecid, allopurinol and febusteate. These are the options. 97. Kwashiorkor liver is fatty liver. 90. Marker for HCC is alpha fetoprotein. 99. Follow-up marker for colon cancer is CEA. 100. Barium anemia showing apple core sign in colon cancer. 101. Chances of mets to liver in colon cancer in percentage is less than 25, 25 to 50, 75% and 90%. 102. Marker for NTD is acetylcholinesterase. 103. X-ray showing duodenum, which part is marked 1, 2, 3, 4. 104. H. pylori is in a risk for GIST, gastric adenocarcinoma. 105. Which statement is true about carcinoid tumor presentation in flushing with diarrhea? Most common site is ileum. Carcinoid syndrome presents after liver meets, present at multiple sites. This question seemed wrong to me as 3 statements were true. 106. Beta blocker ointment is used for hemangioma. 107. Pulsatile proptosis seen in cavernosa fistula. 108. Hemorrhagic fever in cows and cattle cause. 109. Most common site of esophageal cancer is upper third, middle one-third or lower one-third. 110. PR interval corresponds to arterial depolarization and AV nodal conduction. 111. Note a component of teratology of Fallot is normal position of aorta. 112. True state about flank breach, most commonly associated with congenital anomaly, has hip extend and knee flexed, ECV done before 34 weeks. 113. Which is not associated with pain in submucosal fibroids, is torsion, large size associated with endometriosis and degeneration. 114th. Note a treatment for fibroids, GnRH antagonist, GnRH agonist, misoprostol or mifepristone. 115. Most common cause, nerve injured of lower extremity in sciatic, femoral, tibial or common peroneal nerve. 116. Wernicke's encephalopathy, vitamin B1. 118. Triple anthrocentesis not done for. 117. Image of Sarcoptes carbe. 119. Mode of action of gamfribazole is decrease cholesterol absorption from intestine. 120. Image of impetigo and honey color crust is impetigo. 121. Statement true about pneumonia in children is RR more than 50 in 2 month or 1 year old. RR means respiratory rate. 122. 3B inguinal hernia includes pantaloons, femoral direct and indirect. 123. Spina ventosa in a TB of pharynx. 124. False statement about aminoglycoside increased half-life in cystic fibrosis patient. 125. True statement about aminocaproic acid is irreversible inhibitor of plasminogen. 126. Treatment for methanol poisoning is fomepizole. 127. Which is SCRM is tamoxifen. 128. Treatment of choice for postmenopausal osteoporosis is raloxifene. 129. Mummification requires cold and dry, hot and dry, hot and humid. 130. Note the ADX of morphine is mydriasis. 131. Diameter of optic nerve is 1.5 mm. 132. Note a motor complex is actin, myosin, dyne and kinin. 133. Migratory motor complex of GIT. 134. Paranoid schizophrenia cause amphetamine, barbiturates or opioids. 135. False about claudication is rest pain. 136. Sequence of hematopoiesis, yolk sac, liver and marrow. Yolk sac, liver or marrow, YLM. 137. Food poisoning is point source. 138. Effect of erythropoietin deficiency on precursor cells is apoptosis or decreased size. 139. Blood supply of dorsum penis due to internal pudendal nerve. 140. Drug of choice for meningococcal prophylaxis in pregnancy, ceftriaxone, ampicillin and cephalosporin. 141. Medulloblastoma is malignant cerebellum tumor of child. 142. Most common cancer leading to mortality worldwide is breast, lung and skin. 143. Sole afferent from cerebellum cortex are Purkinje and Globi. 144. Biometric scan for iris. 145. DNA fingerprinting blood, which VL, EGTA and NAF or sodium F. 146. Lateral view of CXR showing azygous vein. 147. Not a component of superior mediastinum. 148. Folinic acid used with methotrexate. 149. Thymidate synthase inhibitor. 150. Statement false about reduced osmolarity ORS is glucose 90. 151. In triage, black color code is for unsalvageable. 152. Sunburst sign in osteosarcoma is due to periosteal reaction. 153. False statement about fibroadenoma of breast is it is a risk for breast cancer. Surgery is size more than 5 cm. Surgery done on patient's request. 154. 5-time risk for breast cancer is papilloma with fibrovascular core and atypical ductal hyperplasia. 155. Description about breast cancer histotype, central necrosis. Which type? This type is comatotype and cribriform. 156. Pyronardine belongs to antimalarial, antifungal, antiviral and antibacterial. 157. Correct sequence about LP layers, skin, SC, supraspinatus, interspinatus, ligamentum flavum, epidural space. 158. Not a cause of hemolytic anemia in neonate is breastfeeding is a cause. 159. Diagnosis of gout is done by synovial fluid analysis. 160. For stage 3 breast cancer, which image modality is not done? DEXA bone scan, CT chest, CT abdomen or MRI. 161. Lac operon coding reason is by inducer or promoter. 162. Which is not a cause of gynecomastia, leprosy, TB and Klinefelter. 163. Large ovarian mass is not present in Turner syndrome. 164. True statement about bronchopulmonary segment is it's according to the segmental bronchus, it's surgically unresectable or artery is intersegmental. 165. Ovary follicle reserve is done by urine, LH, antral follicle count or endometrial biopsy. 166. Drug for follicle induction is clomiphene citrate. 167. GCS for dead is 3/15. 168. Cause of SIADH is head trauma. 169. Superior vena cava syndrome is commonly seen in lung cancer. 170. Anaerobic branching bacteria, acid fast bacilli, nocardia, atypical mycobacterium or clostridium. 171. Germ tube test is for Candida. 172. Agar for non-factitious bacteria is nutrient agar and blood agar. 173. Anemia seen in rheumatoid arthritis, normocytic or normochromic. 174. Thalassemia is pregnancy diagnosed by HbA2 which is more than 3.5 by HPLC or Nestoff test, NESTOFF test, Nestoff test. 175. Indoor management for anorexia nervosa is done by depression. 176. Not a component of carpal tunnel is ulnar nerve. 177. Guyon canal, which nerve? Ulna. 178. Second layer of extensor compartment of hand is 179. 179. Prosopagnosia is inability to recognize face. 180. Skilling test would be negative if patient took antibiotic in case of overgrowth of bacteria. 181. Period of viability in 210, 220, 230 or 240 days. 182. ACLS sequence is early access, then early CRP, then defibrillator and then ventilation. EDV. 183. 4 days spots are sebaceous glands. 184. Hand-foot-mouth disease is caused by Coxsackie virus. 185. In catarrhal stage of typhoid, eosinophilia, high WBC, high leukocyte and leukopenia is present. 186. Pulmonary eosinophilia caused by filariasis and echinococcus. 187. Neonatal sepsis caused by group B streptococcus. 188. Copycat suicide seen in adolescents. 189. Obesity is not seen in Carrel syndrome, Moon-Biedl syndrome and acromegaly. 190. Gastric hypersecretion of acid is seen in bypass surgery, small bowel resection and PPI therapy. 191. Colipase enzyme, pancreatic and bile. 192. Antipode transport is one molecule enter and one leaves the cell. 193. Site of gluconeogenesis is liver. 194. Neonatal lupus antibody is SSA anti-Rho. 195. Exocytosis done by calcium. 196. Kit with inspiratory stutter, lung clear, site of obstruction are supraglottic, glottis, trachea or bronchus. 197. Treatment for hyperkalemia is salbutamol, calcium, hemodialysis, all of the following. 198. Dopamine in kidney action is mesenchymal cell contraction. 199. Source of energy in 100-meter sprint is muscle glucogen or muscle glycogen. 200. Creatine source is glycine plus methionine plus arginine, GMA, or you can learn by MAG, methionine, arginine plus glycine or glucine. 201. Cyclic AMP source is ATP. 202. Burning sensation of hand is in the disease syringomelia. 203. MRI showing fourth ventricle. 204. Cause of hemorrhagic conjunctivitis is by enterovirus. 205. Carbonic anhydrase inhibitor used in glaucoma. 206. Which vitamin required for collagen vitamin C? 207. Which kidney stone goes against normal physiological pH of urine is uric acid stone. 208. Regulator of vitamin D synthesis by PTH is manganese. 209. Lynch-Hansen classification is for ankle. 210. Which fatal diameter at LOA is submentovertical BPD. 211. P53 inhibitor is G1S inhibitor. 212. Best disinfect is glutylaldehyde 2%, alcohol 70 to 80% and providine iodine. 213. Glutylaldehyde not used for ET tube, thermometer, bronchoscope or cystoscope. 214. Recurrent laryngeal papillotosis caused by HPV 6 and 11. 215. Only vaccine given to adult is DT. 216. Which B antagonist, which as tocolytic, is Ritodrine. 217. Test done prior CECT is renal function test. 218. Treatment for cachexia is megestrol acetate and cryptoheptadine. 219. Disturbed appetite and increased BMR seen in anorexia and marasmus. 220. Associated with rheumatic heart disease is McCallum plaque. 221. Cell derived from macrophage is epithelioid. 222. Fetal intrapartum monitor done by electrocardiogram, fetal pulse monitor, fetal scalp monitor or electronic monitor. 223. Airway burns first line MX is tracheostomy and elective intubation. 224. Chancroid cancer is caused by Haemophilus ducreyi. 225. Ranolazine is not contraindicated when used diltiazem. 226. Which route of fentanyl not give SC, intrathecal, IM or intradermal? 227. SGLT function for glucose. 228. Not an absolute contraindication for OCP, breast cancer, liver disease, smoker and age 35, and congenital hyperlipidemia. 229. Dendritic ulcer picture associated with decreased corneal sensation. 230. Metabolic encephalopathy, transcortical, sensory aphasia, Broca or anomic. 231. Human malignant hyperthermia is due to calcium channel defect and T-tubule defect. 232. Ovitis keratin precipitate site is corneal endothelium. 233. Liver tumor common in female OCP is hepatic adenoma. 234. Hypervirulent Klebsiella pneumonia causes endophthalmitis. 235. COPD doesn't consist of acute asthma. 236. Intermittent dysphagia is Szyszewski ring. 237. Muscle stretch receptor is muscle spindle, Meissner and Meckel. 238. Chorion component, extraembryonic somatic mesoderm plus trophoblast. 239. Indolent murmur site is left parasternal. 240. Not a cause of upper motor neuron diagnose alpha motor in polio. 241. Not time restraint aim goal objective AGO, or you can learn by GOA, goal objective aim goal objective. 242. Neisseria meningitis infection is common in C5 to C9 deficiency. 243. Mode of action of live vaccine on B and T cells. 244. High muscle to wall thickness, respiratory bronchiole, terminal bronchiole and bronchus. 245. Coracoid process is atavistic aberrant. 246. Bone pain in sickle crisis is due to bone and bone marrow infarction. 247. Delayed onset of puberty in female age 13 year, 14 year and 16 years. 248. Cremasteric reflex nerve done by genitofemoral nerve. 249. 3 to 5 prime endonuclease function. 250. Regarding primary amenorrhea, which statement is true? No known case and clinical investigation. 251. Not a derivative of tyrosine, melatonin. 252. Which cavity should be opened first in suspicion of hanging? Cranial, then thoracic, then abdominal and any. 253. 4 cm breast mass, mobile, axillary lymph nodes. Which stage of breast cancer? 3B, 2A, 2B, and 3C. 254. 72-year man old underwent TURP for BPH under GA. After 1 hour, he develops vomiting and seizure. Cause of his symptoms is due to anesthesia side effects, water intoxication. 255. Man with gross hematuria, excretory urogram shows 1.5 centimeter filling defect in renal pelvis. What should be the next investigation? Urine cytology, ultrasound, or cystoscopy. 256. Glycemic index of glucose 1.5, 1.5 or 2. 257. P-value should be less than for a search to be valid, 0.5, 1 or 0.05. 258. Role of ASHA. I hope this video was helpful for you. Thank you.